This project, titled Developing the Exercise Self-Efficacy in Adults with Intellectual Disability Scale, is being conducted in collaboration with 4 researchers, including myself, Eva Obrusnikova, and Dr. Suminsky, both from the Department of Behavioral Health and Nutrition, and Drs. Cavalier and Gluting from the School of Education, all from the University of Delaware. Only 9% of adults with intellectual disability meet the physical activity guidelines for Americans. The most likely reasons are their high rates of sedentary behaviors and obesity, health literacy gaps, and poor physical fitness. Exacerbated by a lack of support and social and environmental barriers to their participation in health promotion programs, these health disparities often have a negative impact on their health status, social life, and employment, and as a consequence pose a substantial challenge for the U.S. economy. To assist in addressing this public health challenge, research has reported benefits of exercise for adults with intellectual disability. However, systematic reviews continue to identify serious methodological problems in the studies, such as poorly justified or missing conceptual framework, and use of measures with inadequate measurement properties. Thus, it is likely that the knowledge in this emerging and important field is compromised by inaccurate data and incorrect conclusions. Therefore, the long-term goal of this project is to design an evidence-based conceptual framework of exercise behavior by adults with intellectual disability and use it to develop a novel, video-enhanced, multidimensional scale, the Exercise Self-Efficacy in Adults with Intellectual Disability Scale, that will accurately measure the 4 social cognitive theory determinants, including barriers, facilitators, outcome expectations, and goals. We expect to produce a much-needed measurement tool that researchers and practitioners will use to guide their development and implementation of effective skill instructing and motivation enhancing exercise interventions in community fitness facilities. The process of developing and validating the scale consists of 4 steps. The first step was completed prior to the submission of the proposal and includes literature review and construct definition. We are currently working on the second step. The aim of the second step is to generate the scales items by identifying the barriers, facilitators, and expectations of exercising in a community fitness facility as perceived by adults with intellectual disability and certified personal trainers using a qualitative research design. We are currently interviewing certified personal trainers who have the experience of providing personal training to adults with intellectual disability in a community fitness facility. Unfortunately, due to COVID restrictions, individual interviews and photo voice with adults with intellectual disability in a community fitness facility has not been possible. We still plan to complete these activities by the end of the summer. The third step will be completed next year. It aims to evaluate content validity of the scale items, response options, and instructions by a panel of 7 content experts and by cognitive interviewing of at least 10 adults with intellectual disability.